So here we are now in the rehabilitative exercise area, and this is an example of one of the spinal rehabilitative machines that we use. This is called Lateral Traction, and we use this one most commonly for patients who have scoliosis.
Okay.
Now, scoliosis is a condition where for some reason the spine, there's been a wrong signal between the brain and the body, and as the person's grown, their spine has grown crooked and not grown straight. Okay, so a lot of times we see this in teens, young people, and we're able to, the sooner we're able to treat them, the better the results are in correcting the scoliosis. But we treat people from teenage years all the way through adults for scoliosis. And for example, in a case like this, the person's spine is growing this way, and we stretched back the other way to try to get the spine as straight as possible. Here we have her laying down, and we have sections of this table that can move and push her spine over. And over a course of 20 minutes, you'll be on this table, getting your spine stretched out. And we'll do this, we may do this like 3 times a week with the patient.
So you should just lying here for 20 minutes and then that's it, you don't put anything
on? You don't have to, there's
it?
a constant tension now put on the spine, corrective tension, pushing the spine in the direction that it needs to go to become more straight.
Okay.
And then what we do after a course of this type of therapy, maybe over 3 months, later we'll do a post-Ronsen and look, and we can compare, we can see how much we've changed the spine.
Okay. Can you put the spine back into its normal?
Unfortunately, with scoliosis, most times you cannot get the spine 100% straight, but we're able to, we have a lot of success reducing curvatures and getting them a lot straighter than they were when they first started. And in some cases with kids, when they're still young, yes, we can get spines straight.
Yeah. Oh, wow. Okay, so, but after that, they still have to go back to a chiropractor to make sure everything's okay?
Yeah, that's whenever, once they're corrected and stable, then what we do is called maintenance care, and that's on an infrequent basis. That might be once a month, once every 2 months, depending on their condition, just to recheck the spine, correct any of the subluxations, misalignments in the spine, and then make sure their spine is staying healthy.
Okay, and you have some other stuff.
We have a couple other devices here. So this is standing lateral traction. This is for helping to improve the curvature in the low back and curvature in the upper back, the pinang and the punggung.
Okay.
Okay. And then we have another form of therapy for the neck to help restore the curvature in the head. So this is cervical traction. If you remember earlier, we showed you the X-ray, the Ronsen, where the neck was bending in the wrong direction. This device is made to help pull the neck and restore the curvature of the neck back to the proper position. And we have the person here, their head is tilted back, and we have a counterweight pulling on the neck to help reintroduce the curvature into their neck.
Okay.
And we'll have a person on here for up to 15 to 20 minutes, depending on their condition.
So just in this position?
In this position.
Do you add more weight? Or?
So we start out, yes, a good question. We start out easy. We will only start out with a few minutes at first, and we work our way up until we get up to 20 minutes. And then at that point, then we may start adding more weights on as the neck starts to stretch out. And so, like I said, this takes some time. This is a process that happens over the course of a few months. And we can read X-ray or re-Ronsen at the end of this period and measure the change.
Do you ever have kids, children, to have to
Usually you don't have kids. This one is mostly adults. So the children will have doing some of the scoliosis, lateral tractioning, but the adults are doing the neck tractioning and also the standing tractioning.
Okay.